August is Immunization Awareness Month. Vaccinate. Vaccines transform society. And one of the saddest things I think we've seen in the past 10 years or so has been a rise in this anti-vax or anti-vaccination movement, which has led to some preventable diseases coming back. So outbreaks of measles and sometimes of mumps, or even rubella. Measles in particular has gotten press. There was an outbreak not that long ago. These are things that we should not see. No vaccine is perfect, but vaccines do give immunity, and when the herd, which is a not flattering way of looking at society, but when enough people are immunized, we call that herd immunity, when there's a large enough portion of the population to prevent those who can't be vaccinated or for whom the vaccine does not work effectively from getting infected. And that herd immunity has been unfortunately declining, which is why some of these outbreaks have been seen. So ranging all the way from measles, mumps, rubella, to typhoid, to influenza, to rotavirus. I mean, there's so many different diseases that we can either prevent or decrease the numbers and severity of through vaccination. Clinicians have a responsibility to communicate the risks of not vaccinating. As much as people are concerned about the risk of vaccinating, the risk of not vaccinating are higher. And as herd immunity has declined, that means, ironically, that the vaccines are even more crucially needed. And I think among the various reasons that people haven't been vaccinating is they've simply forgotten what the world was like before vaccines. And it's almost a shame we can't send people back in time to see people dying of some of these preventable diseases. I think among the many things that clinicians can do, one of which is to reinforce some of the basic science that we all once learned but have apparently forgotten about how the immune system works and people's fear of vaccines. One of the things that I like to say to reluctant parents is, kids eat dirt. So dirt is loaded with bacteria. There's a war going on in dirt between various bacteria trying to kill each other. And if you just walk into any place where kids have been playing, you're not looking at a sterile environment. So dirt has far more antigens than vaccines do. And I get that you don't directly inject it into your child, but essentially that's what they're doing. So it's not the cleanest way of thinking about it, but sometimes I think it's one that's potentially effective. And then, I don't think that going through the science is truthfully almost as useful as taking people through the psychology of vaccination and how nothing is perfect, but the risks of our modern vaccines is fairly low. They have become more and more purified over time relative to what we used to give people, truthfully, that you can only give them a picture and hope that you sort of lead them to water. Pharmacists have an important role in vaccinations. They, one, vaccinate, and two, are gatekeepers for healthcare for a lot of people. As models of healthcare have changed, the visibility of the pharmacist has increased in a lot of settings, and they have sort of a formal and informal role in educating people about vaccination. While no one can force anyone to take a vaccine, the best we can do is to educate and kind of hope that maybe these repetitive, reassuring messages about their relative safety and efficacy can be something that triggers awareness in parents and other people who are reluctant to vaccinate, to get it done for the safety of their own children. They're putting them more at risk by not vaccinating than by vaccinating, by far.